I'm Rachel McCullough-Sandin. I am the program manager for Population Health Innovations Labs, PATH, CPI collaboratives of our Northwest and Southwest regions of Northern California. We would like to begin this session with a very important land acknowledgement that the Population Health Innovation Lab team respectfully acknowledges that we live and operate on the unceded land of Indigenous peoples throughout the U.S. We acknowledge the land and country we are on today as the traditional and treaty territory of the Native American, Alaska Native, and tribal nations who have lived here and cared for the land since time immemorial. We further acknowledge the role Native American, Alaska Native, and tribal nations have today in taking care of these lands, as well as the sacrifices they have endured to survive to this day. And you can learn what tribes reside in your current place of residence with the chat link. I would like to quickly introduce our Population Health Innovation Lab team. We have our director, Sue Grinnell, with us here today, as well as our Learning and Action Team Director, Catherine Stewart, Merlin Director, Stephanie Boltema, our incredible CPI Coordinator, Jessica Sanchez, Esme Salas, who is on the Merlin team, and I hope I'm not forgetting anyone, is Trish Perizzelli here to introduce the members of PCG.
I am. Hi, everyone. My name is Trish Perizzelli. I'm an associate manager with Public Consulting Group, and I just realized my camera is off again. Let me just turn that back on. There we go. With me today, we have Tara Murphy, who is our policy lead for the TA Marketplace, Afomia Tesfaye, who is our project manager for this work stream. And I believe we've got a couple of other staff on the line as well. So you may, if we're doing questions and answers, you may hear from a lot of members of the PCG team.
Fantastic. Thank you so much. We are definitely doing questions and answers. We're encouraging folks to put those in the chat along the way, just in case we need to clarify, or if you have a burning question you don't want to forget. We're going to try to speed through the introduction to focus on the content of today's webinar and leaving time for more Q&A at the end, either chat or verbal. So the PATH Collaborative Planning and Implementation, CPI, initiative under CalAIM's efforts to improve Medi-Cal. We have our local collaborative planning groups that I mentioned, made up of counties that are divided into two regions, not divided by us, but assigned as facilitators. And so one of our main responsibilities as we meet with these groups, I know many of you are already registered. It's fantastic working and collaborating with you. Is to identify pressing needs and gaps in knowledge, resources, and coordinated care as we figure out how to promote readiness for enhanced care management and community support services. And types of organizations involved in CPI include our managed care plans, providers, CBOs, county agencies, public hospitals, tribes, and others. If you are not already registered for those groups and would like to be a part of it, please do join us. We can put information in the chat. You can go to our website, and we are here today to move forward in that readiness. Next slide. So Population Health Innovation Lab is the facilitator for these CPI groups for these two regions. And we have a multitude of responsibilities serving all of you as we work to implement ECM and community support services. And today we're focusing on offering webinars and programming. So we all know that the TA Marketplace is new and we're trying to figure out what it is and how it works and how it can help us, how we access it, what's there, et cetera, et cetera. And so this is one of the many things that we do together. Next. Can we go back up one? Also, the web link for these CPI groups were just put in the chat. And so feel free after this to be able to go and explore We had a slide of our regions that I think we lost for a split moment, but that is, oh, here we go. Perfect. So we've got our Northwest CPI group, which is Del Norte and Humboldt counties. And then we have our strangely named Southwest region of Northern California, and that's Mendocino, Sonoma, Marin Lake, and Napa counties. So together we are working on those regional implementation, identification needs, and also solutions together. And this is one thing that we needed to figure out what this TA marketplace is. Again, a gentle reminder that we are recording. Feel free to please turn off your microphone and feel free to turn off your video if you choose during the bulk of the presentation. Any other capacity building and resource trainings you need on any other topic, please put in the chat. We will make a note of it and see what we can additionally facilitate for all of you. All right. Catherine, Sue, Jessica, anything I forgot before I hand over to Trish? Okay. Trish, thank you so much.
There we go. I think I got it now. But I get for putting up my slides before unmuting. So what we're going to walk through here is a little bit of, this is what we show to potential recipients and to potential vendors, but also a little bit tailored to this group. So I know that we probably don't need a full overview of PATH and CalAIM. I think, everyone who's here probably has a good understanding of PATH and CalAIM, but just to give a little bit of overview, this is what we share with recipients and vendors on webinars for them. So firstly, what is PATH? It's the Providing Access and Transforming Health Initiative. Within PATH, there are these 4 different work streams. There's the cited work stream and the justice involved work stream, which are grant programs to help organizations to get involved in community supports and ECM. And then there is the CPI initiative, obviously, which you're all familiar with. And then there is the TA marketplace. So the TA marketplace is really a place for organizations who are planning to become providers of community supports or ECM to seek either hands-on trainings or off-the-shelf resources to help them to engage with managed care plans, to help them to deliver services, to understand the populations. And what we've done is we've determined a list of 7 domains within the TA that we offer. And those are just the different subject areas that you can seek TA in. And that's to help guide organizations in really thinking through what they need. Those domains were, we were assisted by the Technical Assistance Coordinating Table in identifying those domains. So we have heard from a lot of the community-based organizations in selecting the types of TA that are available. So, here are a couple of examples of the types of TA that we're imagining. A lot of training-based, some prepared, modules around data sharing, but largely it's going to be a lot of training-based technical assistance that's going to be provided. So one of the things that we've been flagging for organizations when we talk to them through either our mailbox or listening tours is letting them know the PATH initiative, the TA marketplace, the organizations that are seeking that TA, they do not have to pay a single dollar for those services. So that is going to be paid through the PATH initiative. So the way this works is we have this list of vendors. They're in our marketplace. You can shop from that entire list of vendors if you're an eligible organization. And the eligible organizations are listed here. And if you are one of those eligible organizations, you choose a vendor, you choose a project, as long as it aligns with the goals of CalAIM and is driving you towards delivering those ECM or community support services. And it'll be approved by DHCS. And so DHCS will pay for that technical assistance. You won't have to pay for it. So, just a little bit of explanation here. So there can be organizations that are engaged in collaborative and engaged in the TA marketplace and engaged in cited NJI. In fact, we encourage that. If you need a grant to get off the ground, then cited or JI would be where you would go for that grant. But if you need technical support, you would come to the marketplace. And, if you want to understand what's going on with other providers in the community, you would come to collaborative, right? So we expect there are going to be a lot of organizations that are engaged in multiple initiatives, if not all four, which, would be only those JI organizations. So more specifically about the TA marketplace itself. So what is the TA marketplace? It's a little bit like a shopping mall. So what you can do is and anyone can browse right now. You don't have to be registered. You don't have to have a login to be able to browse the marketplace. You can go to the technical assistance marketplace through the CA Path website, which you're probably all familiar with as you're part of a collaborative. And you can look at all of the different vendors. There are 46 vendors currently, but we did just open another round of vendor applications. So likely in the next couple of months, we will be adding new vendors, adding new projects to the marketplace. So if you don't see something that, really matches what you need, it may be coming. And I encourage you to reach out to the marketplace and let us know if there's something you need that you don't see, because we will go out of our way to find a vendor who can deliver it to you. So, the virtual shopping experience has been live since January 31st. You can shop by type of project. You can shop by vendor name. If you're already working with a vendor you're comfortable with and they're one of the vendors on the marketplace, you can just, say, I want to work with them. We came up with a project together. This is what we want. So you don't even have to pick something off the shelf. You can just say, I know which vendor is right for me. And, the TA is going to be in one of those 7 domains I mentioned earlier. So what we've heard from the community, from organizations like you, is that building data capacity is one of the deficits right now for organizations that are looking to deliver ECM and community supports. So it's learning about data collection, appropriate data management, data sharing, data use. Another domain is community support. So really understanding those social drivers of health and how that is delivered in the ECM or community support model. And then engaging and navigating CalAIM through Medi-Cal managed care. So I can tell you, we've received 8 applications so far for projects already. And that domain is the most popular so far. So it looks like a lot of interest in learning how to work with managed care organizations. So just noting that that's an area we're already seeing a lot of interest. We have a domain on the populations of focus. So, if you want to learn more about individuals who are eligible for ECM and community supports, we have vendors who are familiar with that area. Promoting health equity, supporting cross-sector partnerships, and then workforce. So workforce development, workforce training. There are a lot of off-the-shelf modules in that area. Another thing to note is on the TA website, so the TA Marketplace website, we indicate if a vendor has specific experience in rural communities. So if you're a rural provider, you may want to work with a vendor who's familiar with the specific challenges of rural providers. And so there's a flag, which you can see on their vendor profile, indicating that they have some experience working with rural providers. We've also indicated women-owned businesses, veteran-owned businesses, and minority-owned businesses, just, to allow organizations to really filter, which vendors they might want to work with by their experience and the communities they serve. So I've mentioned this a little bit, and this is a good clarifying point. We have off-the-shelf TA and hands-on TA. And when you enter the marketplace, you're going to be confronted with that choice. Do I want something off the shelf or do I want something hands-on? Well, how does this work? So if you know what you want, you can go hands-on. If it's like a new project, it's novel, you know the vendor you want to work with, you're selecting a vendor, describing the project, and that's what you're going to put in your project eligibility application. If you don't know what you want, we recommend you look at the off-the-shelf TA projects, and these are pre-packaged. So the vendor has created an entire module. It's either a training or a guidance document or some other prepackaged item that they are going to give you, and you can pull it down off the shelf is how we describe it. So what you're saying is, I want this thing that's already been developed, it's fully described, we know how long it's going to last, we know how many people are going to be trained, we know what kind of resources we're going to get, and that is the thing I want. So if you want to browse those, they're all listed under off the shelf on the marketplace. And if none of them meet what you might need, then you can create a hands-on project. So you find a vendor who has the right experience that matches what you're looking for, and then you would create that hands-on project with the vendor. If you don't know which vendor you want to work with, you can still make a hands-on project. Just pick some vendors within the domain of the project you're thinking you'd like to do, and we will work to match you with a vendor. So this doesn't need to be excuse me, it's like a scary experience or a difficult one. If you have some idea of what kind of services you need, the TA Marketplace team will help you to get them. So who is eligible to receive TA, right? That's the question. So really, any provider, any organization that's going to provide ECM or community support is going to be eligible to receive TA. The list is here. There is a possibility of being approved if you're not one of the listed provider types here. You would need DHCS approval for that. But largely, we have 3 different attestation forms. So the first step in becoming eligible to receive the TA is doing the eligibility application. So the eligibility application asks you, are you currently contracted with a managed care plan? Are you currently talking to a managed care plan about contracting? Or have you not engaged at all with a managed care plan? If you're contracted with a managed care plan, you're going to send us your contract cover sheet and you're going to be approved. If you are in conversation with the managed care plan, we're going to ask the managed care plan to sign an attestation on your behalf to state that you are thinking of becoming an ECM or community supports provider. And if you fall into that third group that you're not sure you're ever going to contract because of circumstances, then you would need DHCS approval. And there's an attestation form for that. And DHCS would weigh whether or not your organization is appropriate to receive TA through the TA Marketplace. And just noting in bold down there at the bottom that managed care plans themselves are not eligible to receive TA through the Marketplace. That said, there's nothing stopping them from reaching out to a TA vendor that is on the Marketplace and contracting outside of the TA Marketplace process. The contact information for the vendors is there. So, it is a resource, but DHCS is only going to pay for TA that is delivered to potential providers of ECM and community support. So there are 2 different types of, there's lots of different types of TA available, but if you are already contracted with a managed care plan, you're going to have access to additional resources as compared to those who are not yet contracted. So for those organizations who are not yet contracted or have not yet engaged with the managed care plan at all, they will only be eligible for the off-the-shelf projects in the engaging in and navigating CalAIM domain and the ECM populations of focus domain. So really just learning about what PATH is, what CalAIM is, learning how to contract. They're not going to be able to access those additional more in-depth like data management TA until they have a contract with the managed care plan. So we've talked a little bit about the process. This is it in extreme detail. We've broken the process down into steps because it makes the application process more simple for organizations that are trying to access TA. So firstly, there's the eligibility application, being deemed an eligible entity to receive TA, and then you're going to shop on the TA Marketplace. Once you've decided on a project or a vendor, you're going to submit the eligibility application, which is very short. I just ran through it this morning. It took 20 minutes to submit the entire application, so not very difficult. And then that application will be reviewed by DHCS and the PCG team before you move to a scope of work and budget process. And the reason why we do this very short form application is if you're on the wrong track, we don't want you to submit, we don't want you to work on a budget for weeks and weeks and then be disapproved. We want you to tell us what it is you want, and we'll tell you, great, you're on the right track, before you spend all that time making a scope of work and budget. So once the eligibility application is approved, you'll receive the template for the scope of work and budget, which you'll work on with the vendor. So largely, I think in most arrangements, the vendor will be completing the scope of work and budget. And then the organization seeking TA will be approving it, because the vendors, they have experience with scopes of work and budget. So, you know, they're prepared to do that work on your behalf and just have you sign it. Once that scope of work and budget is approved by DHCS, then we'll finalize a task order with both the recipient and the vendor, and you'll be able to receive the TA. Now, that process seems very long, but I promise it does not have to be. So the review timelines are getting shorter and shorter with each application we receive, as we recognize there are repeat requests for TA that we know we can approve very quickly. And if you're choosing an off-the-shelf project, the review process is expedited, especially for the scope of work and budget, because it'll be the same for most organizations seeking that TA. So we can turn around those applications very quickly for off-the-shelf projects. It will take slightly longer for a new project, like a hands-on TA project. So how do we get there? Once again, it's that three-step process. So first, you're deemed eligible through the registrant eligibility verification process. Then there is the project eligibility application, which is very short, only a couple of questions: what kind of TA you want, who you want that from. And then the more lengthy process is the scope of work and budget, where you're determining, you know, in the case of a training, how many people will be trained, how long will the training take, how many months will it span, you know, will there be deliverables that are produced outside of it, are there costs outside of, you know, staff time. So all of that will be included in that scope of work and budget process. But once that scope of work and budget are approved, as I said earlier, you will be able to receive the TA very quickly. So where can you find out more about all the things I just described? We do have a reference materials page on the TA Marketplace website. If you're having difficulty in accessing the TA, any of the forms, we have a sign up and password reset guide, which we've been sharing pretty liberally because we've had a lot of requests, people getting stuck at different parts of the process. So, you know, we like to highlight that one. So if you're getting to the point where you see a QR code, I feel like maybe someone here got confused by a QR code trying to access the TA Marketplace. This guide tells you how to move on from that step. And I think this is probably my last slide before we get to questions. And that's just, you know, what's the timeline here? What are we talking about? Well, the TA Marketplace is currently live. We expect it's going to operate for 5 years, so through 2027. You can currently submit your project eligibility applications, which means pretty much the entire process is live for organizations seeking TA. The only other thing that's not on this slide that I would flag is that we currently do have that vendor window open. So if you think you would make a great vendor to other organizations, we can provide you with that application, and you know, you can become a vendor on the TA Marketplace. So hopefully I didn't rush through that too much, but I did want to leave a lot of time for questions because I'm sure there are many. So let's take a look. I think I can pull up the chat.
Yeah, I was going to, the first question that I saw is just about the slide deck and whether we will have access to this and to share with the CPI partners.
Yeah, so actually this is an abbreviated version of the much more in detail slide deck we shared in our vendor onboarding webinar and our recipient onboarding webinar. So those are both found on the resources page of the TA Marketplace. There we go. So we have the transcript and the full webinar there. So if you want these slides, they can be found there.
Perfect. The next, if anybody has questions, feel free to use the little hand raise feature on here. I'll just kind of go through the chat and say any other ones I saw. I think Janelle asked, these vendors will help for free, question mark.
Oh, yeah, well, free to you. I think that's the important part, is that the vendors are being paid. They're just being paid by DHCS through this PATH initiative. So, you know, there's across the 4 initiatives, a significant amount of money set aside for both, you know, the grant funded through Cited and the justice involved initiatives, and, you know, for collaboratives like this one, and for technical assistance. And so the expectation is that a normal TA project is going to be anywhere between like $1,000 if it's like a small single-use training, up to, you know, it could be like $250,000 maybe, you know, for a very, very large TA project that's potentially serving multiple organizations. So, you know, that does not need to be borne by the organization. That's why we have this process and this marketplace, and this, you know, approval process is DHCS will be, or PCG on behalf of DHCS will be paying for those TA services. So no dollars will move from the organization receiving the TA to the vendor.
Does that clarify your question, Sue?
Yeah, I didn't ask that question. I think Janelle did. My question was like, then who's actually paying the bill, which sounds like it's maybe you all as the third party administrator are the one that's paying it. So the bill would go to them. Okay.
Yep. Yes.
Great.
And so if you're a vendor, and I guess this is, you know, just like that additional flavor text here. So there's a portal for recipients where they request the TA. There's also a portal for vendors where they can submit invoices and banking information and be paid. So, you know, all of this is automated through that sign-on system on the TA Marketplace website.
Great.
And one more question that I saw in the chat is, where is the attestation form for DHCS found?
Yeah, so it isn't on the website currently. We've been providing it via email because we're waiting for the next update to the website. But if you reach out to TA, I'm going to say it wrong. It's TA-marketplace at CA Path. I'm sure we've got our email address on here somewhere. We'll provide it to you, so you know you can move forward with that process.
Another question in there.
Thank you. Yes, I see in the chat, Rachel has a question.
I was just wondering if an organization does not yet have a contract. We know that that can be a long process. We know that it can have a lot of different types of barriers. Also, the data sharing pricked my ears because we know that getting data systems in place and getting ready for data sharing that really benefits ECM and community sports is also a long process. If they don't find something in the off-the-shelf resources, what's the best way to communicate that to you and your team? And how do you guys plan to address those needs? I know that there's that special approval, you know, through, was it DHCS, where they could still work with a vendor, but it seems like maybe different approaches such as filling those off-the-shelf gaps in addition to making the special approval process easier. So can you walk us through that if folks feel like they just keep hitting barriers getting contracts?
Yeah, so it's a simple process in that the whole process is reach out to the TA inbox, and I'm pulling the I'm so bad at remembering email addresses. I want to make sure I give it to you correctly. But if you access or email us in the TA inbox, we will reach out to all of the vendors who do hands-on and see if any of them could create an off-the-shelf product that we could, provide you. So that's another way we can move forward. Also, DHCS may be willing moving forward to add more eligible products that or projects if they find a lot of recipients requesting things that they're not eligible to receive prior to contracting. So, we encourage you. Oh, thank you, Tara. She's so much better than me at putting things. Put it right in the chat. TA-marketplace@ca-path.com. Anytime there's dashes, I put them in the wrong places. So yeah, so if you reach out to the TA inbox, we will be able to surface it to DHCS that there's a TA that's requested by an organization that's not contracted. And we can also reach out to our vendors and see if they can provide something in an off-the-shelf capacity.
Trish, thank you so much for coming today and being with us. I'm curious how you've seen or how you envisioned kind of the interaction between this marketplace and the CPI collaboratives, because we, have some funds for TA. So just wondering about that. And then I see Amy has her hand up too after that. So
yeah, so I think, these, just like the two grant related work streams work very closely together. I think the CPI work stream and the TA marketplace work stream are going to have to work very closely together, because one of the things that we're looking at as we're tracking all of these applications coming in is what kinds of TA are being requested, and are they actually better suited for a collaborative? Because if everyone wants the same thing, maybe we need to be just providing that, kind of in a more collaborative setting. It doesn't need to be from a vendor. It could be something that we provide more broadly. So we've already identified maybe one area where, we've had requests for TA and we might form a new collaborative around that, right? But, more to come on that. But I think that's the main back and forth is, if you're hearing things in the collab work stream or in the CPI work stream that aren't being addressed and we need technical assistance to move that forward, then, you would let us know and we could maybe find vendors who can support that. But I think it also goes the other way, where we would identify, if we're seeing so many people looking for the same thing, maybe it's more appropriate for a learning collaborative.
Okay.
So I have two questions if Sue's done.
I am done, Amy.
Awesome. Okay. I didn't want to
No.
bump into your time. So my two questions are, one, is there a limit to what an organization can access? Like you get 3 off the shelves and 1 handcrafted.
That's a great question. And I think, anyone who's familiar with the Massachusetts model, they did have a limit. They capped them at, I think it was $350,000 of TA, and that was that, because they did it on a gift card system. The California model is not like that. There is no hard limit on the amount of TA. We are tracking how much TA an organization receives, and there's definitely a point after which DHCS is going to have a discussion about whether or not it's necessary or the best use of funds. But there is no hard limit to the amount of TA you can request.
Perfect. And then the second question is, if somebody, I have not, but if somebody has asked for an off-the-shelf service, so they've gone in and they haven't heard back from you yet, what sort of time frame would you recommend to circle back on that? And is it the general marketplace, or is there a I have a problem email that's not the general email?
So always the general email, because we can triage that to the appropriate person on the team faster than through multiple channels. So we've just only opened up the project eligibility application very recently. And so, we're in a ramp up phase. So we are reviewing the project eligibility applications that we've already received, the 8 that we've received. I would hope that, it will not take more than a month to get them fully approved. but it should be significantly less than that moving forward, once the process is, fully up and running and DHCS has an approval flow.
Okay, so chasing that question, because so nobody wants to be the person that's harassing you to ask you for a free education.
You can harass us. You
Oh no,
definitely can.
I am not the person with that problem. I'm saying that others may not want to be the harasser there in that. If somebody submits a request for TA, they should wait a month before reaching out to you, or they should wait
No.
2 weeks.
They can wait, they can reach out to us as often as they
Okay.
like. It is honestly the answer. We have a team that is 24/7 on the mailbox. Now they're going to be kicking me for having said that, but really that's what we're here for. We are the technical assistants for the technical assistance marketplace. So, if you're feeling like it's taking too long, let us know. If you're concerned that we lost your application, let us don't worry. It should not be on the part of the organization to be sitting there worrying about it. They can reach out to us.
So if somebody, I'm sorry, this the last one I promise, and then I'll let somebody else do it.
Sure.
When someone goes through and they submit an application, is there a confirmation that you finished it? Is there something to let them know?
There is. So
Okay.
within the console, so we call it the recipient console and the vendor console. We've got these two separate parts of the website. You can see all of your open applications, the status of that application. You can go in and review all the components, but it does in fact have like a dashboard that states, is it in approval status? Is it being reviewed? Has it been rejected? Has it been approved? So you can see that at any time you can log in and see that.
Great, thank you so much.
It looks like Lisa has her hand up.
Thanks. Just a quick question. Is there any plans to have, say, like a curated recommendation? I'm thinking for like a traditional kind of local CBO where there is, we would recommend you start here. Like, I think there's so many choices on the marketplace. And I'm sorry I work for Marin County Health and Human Services and Public Health. So, but when I see there's so many choices that you almost want a Stitch Fix version of TAM. So it's my best equivalent where someone's actually curating. Yeah. Is there any thought around that?
I love that. And what we've been thinking of doing is creating user stories. So short little videos that says, I'm a CBO and I'm having a really hard time training my staff to be able to deliver this service. What do I do? Well, first, you're going to go to the workforce domain and you're going to look at what's off the shelf. And if any of that matches, pick that. And if it doesn't match, maybe you can find one of the vendors in that workforce domain that can help you develop that training, right? So I think, that's like a 1-2 minute video we could create right there. But if you have user stories or, these different scenarios for an organization that might be, utilizing the marketplace, let us know. You can send that to the TA Marketplace inbox, and it might be a video on the website. That's we love the feedback.
Thank you.
I have a question about the hands-on type of projects. I'm sure that those are much more involved and maybe there's less capacity to have so many people have their own hands-on projects. So I was wondering if those are competitive applications or just to get a feel for accessibility and whether it's approached like equitably.
Yeah, so one of the things that we've kind of added to the application for hands-on is that you can select up to 3 vendors. And that's, if we reach out to the vendor who's your number one choice and they say, listen, I'm working with 10 organizations right now, I won't be able to start this project until December. That's not a good fit. We want to make sure you do get a vendor who's going to be able to help you immediately with your TA needs. So, with the hands-on projects, we do recommend that, you do select more than one vendor, and then we will work with those vendors you select to make sure that we have one who can help you in the short term. Does that answer the question? I hope that's
yeah.
Okay.
Yeah, I think so. Thank you.
I think one of our goals as CPI facilitators is to dig into these resources and contents and to really thoroughly understand them. So as we're hearing gaps and needs among our partners, that we can also help direct traffic, and wondering how much, Trish, you and your team also plan or hope to be those travel agents, right? Like, I think we want to go to the beach and I just don't even know how to start thinking about that, right? Like,
Yeah.
is are you a helpful place also for people to go if they're still in a place where like, I don't even know what I don't know. Like this
Yeah.
is, and then kind of user stories will help, right? But then also, and I've clicked on the marketplace, I sympathize, right? You're like, I've got a bunch of company names and I don't even, so how much are you guys kind of problem solving guides, and how much do people need to come to you already having packaged up where they want to launch from? And then how do you see kind of your role as TA Marketplace and our role as CPI facilitators promoting readiness along this implementation path? What are your best ideas at where are you excelling? That's like 5 different questions, but
Yeah,
that's where my
no,
mind
that's
is
great.
turning.
So the answer is we're all here to help, right? So if you're part of a collaborative, you can definitely work with your collaborative facilitator to, really crystallize the TA you need. I mean, that's what CPI is for, one of the many functions of CPI. But you can also come to us directly. So, again, emailing that TA Marketplace inbox. We've already gotten some requests that are just, I have this very specific need. I'm an organization unlike any other. So I need a vendor who understands my specific circumstances, but I also need this very specific TA. And we said, we've got you. We emailed all of our vendors in that domain and said, who here has this expertise? And we're trying to make those connections. That said, there are going to be cases where we're not going to be able to make those very specific connections if we don't have a vendor. So I think, it's also a great place for us to collaborate with the CPI initiative to identify those areas and identify vendors in the community who could support these very niche cases and get them onto the marketplace.
That's great. And I'm wondering if anyone on today's call wants to offer how they reached out to the marketplace and maybe started the process. And I don't know if that applies to anyone here, but if anyone wants to offer that experience, feel free in the chat or raising your hand. The other question I had, Trish, in that gap is there an upstream mechanism or structure for vendors to be noting requests or issues that they encounter over and over again? So if there is a technology platform, or if there is a contracting process step, or if there is a, anything, right? And that's coming up with everybody. Is there a communication mechanism in place to funnel that back up to DHCS or those, technology or software companies to troubleshoot things upstream?
There is.
Is there a way that we can partner with you in that as well?
Yeah, no, I mean, absolutely. I think, it's going to take a while for us to get this piece up and running, but on a quarterly basis, all of the vendors who are engaged in a TA project are going to be reporting back to PCG and DHCS on how the TA is going, what kind of roadblocks they're seeing. Is there a potential off-the-shelf resource that we could be creating out of any hands-on TA they're delivering? Really, all of that ongoing progress reporting. It's going to inform the future design of the program. We're also going to be asking recipients to answer, and I think it's only 7 questions, a very quick survey, just how was your TA experience? And that's to, ensure that we are matching the best quality vendors with our recipients. So, we do get the feedback loop on the vendors from the recipients, and a feedback on, what's missing, what are our gaps, is there a particular IT problem that everyone is coming to us with that we need to, address upstream. We're going to be getting that in that quarterly survey of all the vendors who are providing TA. but we'd also like your help. I mean, any source of this information is good. You know, we want all the help that we can get to make this the best possible marketplace.
Yeah, something we talk a lot about is not duplicating work. And so if we're also hearing that, you know, we could join forces. And I do want to make sure that other participants, I mean, even if you don't know where to find something on the website, right? Like this is a webinar with a place for big or small questions that apply to each of your individual organizations. This is for you.
I think I put them all to sleep.
Trish, do you have, no, this is great. Do you have kind of verbal user stories that you can think of?
So, you know, really that is what we're hearing most is just people don't know where to look and they're new. You know, they know that they're a good fit for ECM or community support, specifically community supports is what we're hearing a lot of, but they don't know where to start. And so, you know, I think that the number one thing we've been telling people is if you don't know what kind of project you're looking for, take a look at those off-the-shelf projects because there's over 100 of them on the website. That's not to say that everything you might need is there, but there's over 100 offerings. So even if you see something that's similar, it might spark an idea in your head and you can always create that hands-on project that's similar to something that's off the shelf. Once you've got a good idea of what's available in the marketplace.
This has been extremely helpful for me. I feel in my role as one of the CPI facilitators that I have a newfound confidence when I look at the website and really hope that I can facilitate a referral or maybe even work with some of the partners in this meeting from the North and Southwest region about looking at that resource and really hopeful that we can get people engaged and they can find their ideal TA assistance. And if not, I'm really happy to facilitate a conversation with you all in that email about maybe any gaps that we might discover. And I'm hopeful that we can get the technical assistance that is needed. So thank you so much. I really appreciate your time with us.
Happy to do it anytime, really. For getting the word out. That's the most important thing.
Thank you.
Is there any other questions, last minute thoughts? And I would be happy to give you all back some time if there isn't.
And also don't forget, if you have ideas for other types of events or things that would be helpful for you, please put them in the chat because, you know, really we are here in service to you. And if there's an area you'd like us to go deeper on, we would love to try to do that.
Yeah.
And Trish, are you able to make the slides available?
Yeah, I think we just need to get DHCS sign off real quick on that, but yeah, we can do that and turn them around to you.
Perfect. And then we could either email them back out to participants and or put them on our website.
Great.
Yeah, and I think you said that the larger deck is available on the TA Marketplace page. So if you scroll to the bottom, if you click on the link there, it'll just download straight to your computer if you were interested in seeing the larger deck of slides.
Yep.
Wonderful. Okay, yeah, thank you so much. I'm super happy that we got to have this conversation. Very grateful for the participants who were able to join. And again, this is a recorded little session here. And so we'll make sure to make this available on our website pretty soon.